Cervical cancer causes and when to see a doctor. Cervical cancer is a growth of cells that starts in the cervix. The cervix is the lower part of the uterus that connects to the vagina. Various strains of the human papillomavirus, also called HPV, play a role in causing most cervical cancers. HPV is a common infection that's passed through sexual contact. When exposed to HPV, the body's immune system typically prevents the virus from doing harm. In a small percentage of people, however, the virus survives for years. This contributes to the process that causes some cervical cells to become cancer cells. You can reduce your risk of developing cervical cancer by having screening tests and receiving a vaccine that protects against HPV infection. When cervical cancer happens, it's often first treated with surgery to remove the cancer. Other treatments may include medicines to kill the cancer cells. Options might include chemotherapy and targeted therapy medicines. Radiation therapy with powerful energy beams also may be used. Sometimes treatment combines radiation with low-dose chemotherapy. Symptoms. When it starts, cervical cancer might not cause symptoms. As it grows, cervical cancer might cause signs and symptoms such as vaginal bleeding after intercourse, between periods or after menopause, menstrual bleeding that is heavier and lasts longer than usual, watery, bloody vaginal discharge that may be heavy and have a foul odor, pelvic pain or pain during intercourse. Causes. Cervical cancer begins when healthy cells in the cervix develop changes in their DNA. A cell's DNA contains the instructions that tell a cell what to do. The changes tell the cells to multiply quickly. The cells continue living when healthy cells would die as part of their natural life cycle. This causes too many cells. The cells might form a mass called a tumor. The cells can invade and destroy healthy body tissue. In time, the cells can break away and spread to other parts of the body. Most cervical cancers are caused by HPV. HPV is a common virus that's passed through sexual contact. For most people, the virus never causes problems. It usually goes away on its own. For some, though, the virus can cause changes in the cells that may lead to cancer. Types of cervical cancer. Cervical cancer is divided into types based on the type of cell in which the cancer begins. The main types of cervical cancer are squamous cell carcinoma. This type of cervical cancer begins in thin, flat cells called squamous cells. The squamous cells line the outer part of the cervix. Most cervical cancers are squamous cell carcinomas. Adenocarcinoma. This type of cervical cancer begins in the column-shaped gland cells that line the cervical canal. Sometimes both types of cells are involved in cervical cancer. Very rarely, cancer occurs in other cells in the cervix. Risk factors. Risk factors for cervical cancer include smoking tobacco. Smoking increases the risk of cervical cancer. When HPV infections happen in people who smoke, The infections tend to last longer and are less likely to go away. HPV causes most cervical cancers. Increasing number of sexual partners. The greater your number of sexual partners and the greater your partner's number of sexual partners, the greater your chance of getting HPV. Early sexual activity. Having sex at an early age increases your risk of HPV. Other sexually transmitted infections. Having other sexually transmitted infections, also called STIs, increases the risk of HPV, which can lead to cervical cancer. Other sexually transmitted infections that increase the risk include herpes, chlamydia, gonorrhea, syphilis, and HIV or AIDS. A weakened immune system. You may be more likely to develop cervical cancer if your immune system is weakened by another health condition and you have HPV. When to see a doctor. Make an appointment with a doctor or other healthcare professional if you have any symptoms that worry you. Prevention. To reduce your risk of cervical cancer, ask your doctor about the HPV vaccine. Receiving a vaccination to prevent HPV infection may reduce your risk of cervical cancer and other HPV related cancers. Ask your healthcare team if an HPV vaccine is right for you. Have routine PAP test. PAP tests can detect precancerous conditions of the cervix. These conditions can be monitored or treated in order to prevent cervical cancer. Most medical organizations suggest beginning routine PAP test at age 21 and repeating them every few years. Practice safe sex. Reduce your risk of cervical cancer by taking measures to prevent sexually transmitted infections. This may include using a condom every time you have sex and limiting the number of sexual partners you have. Don't smoke. If you don't smoke, don't start. If you do smoke, talk to a healthcare professional about ways to help you quit. Treatment. Treatment for cervical cancer depends on several factors, such as the stage of the cancer, other health conditions you may have, and your preferences. Surgery, radiation, chemotherapy, or a combination of the three may be used. Surgery. Small cervical cancers that have not grown beyond the cervix are typically treated with surgery. The size of your cancer, its stage, and whether you would like to consider becoming pregnant in the future will determine which operation is best for you. Radiation therapy. Radiation therapy uses powerful energy beams to kill cancer cells. The energy can come from X-rays, protons, or other sources. Radiation therapy is often combined with chemotherapy as the primary treatment for cervical cancers that have grown beyond the cervix. It also can be used after surgery if there is an increased risk that the cancer will come back. Chemotherapy. Chemotherapy uses strong medicines to kill cancer cells for cervical cancer that has spread beyond the cervix. Low doses of chemotherapy are often combined with radiation therapy. This is because chemotherapy may enhance the effects of the radiation. Higher doses of chemotherapy might be recommended to help control symptoms of very advanced cancer. Chemotherapy may be used before surgery to reduce the size of the cancer. Targeted therapy. Targeted therapy uses medicines that attacks specific chemicals in the cancer cells. By blocking these chemicals, targeted treatments can cause cancer cells to die. Targeted therapy is usually combined with chemotherapy. It might be an option for advanced cervical cancer. Immunotherapy. Immunotherapy is a treatment with medicine that helps your immune system kill cancer cells. Your immune system fights off diseases by attacking germs and other cells that should not be in your body. Cancer cells survive by hiding from the immune system. Immunotherapy helps the immune system cells find and kill the cancer cells. For cervical cancer, immunotherapy might be considered when the cancer is advanced and other treatments are not working.